Hello, friends of the Latino Chamber of Commerce of Boulder County. My name is Karla Colin, and I am here with two amazing friends. They've been great supporters of the Chamber for a long, long time. And right now we are partnering and doing amazing things. One of those amazing things is informing the Latino Chamber members and public about amazing programs and information that they have in regards to public health. So I'm gonna talk to Madison and Karely here soon, but first I'm gonna ask them both to introduce yourself, tell us what you do, and yeah, anything that you wanna share with our public for them to know you. And let's start with Madison.
Great. Thanks, Carla. Hi, everyone. My name is Madison Gehring. My pronouns are she, her, ella. I'm a white woman in my early 30s with long blonde hair, and I'm a senior professional research assistant at the Colorado School of Public Health. I have my master's in social work and public health. However, most of my professional background is more in community development. For those of you who are familiar with Boulder County, I used to work at EFA, Emergency Family Assistance Association, and I've also helped run a hotline for survivors of human trafficking. So I currently support our research and total worker health training efforts in Mexico and Guatemala.
Thank you, Madison. And now we have Karely.
Hi everyone, my name is Karely Ruiz Hernandez. I go by she, her, ella. I'm a Mexican woman in my mid-20s. I'm a professional research assistant at the Colorado School of Public Health, and I have a master's degree in public health as well. My professional background is in advocacy for the Latino and immigrant community, and I've worked with community organizations to promote health equity within communities affected by COVID-19. I've also been an active champion for immigrants and students of color for higher education opportunities in Colorado. I currently also support our research and total worker health training efforts in Mexico and Guatemala.
Thank you so much, Karely. And if any of these two faces look familiar to you, they've been with us before. They joined us for Feria del Tamal. They had a table there. So just so you know, they've been longtime friends of the chamber. Even before my time, Madison used to support in other efforts to the chamber. So it's great to have you both here. And let me start with this question, because when we first met last year and started talking about collaboration and partnership, you mentioned total worker health. And that was a completely new topic for me that I didn't hear before. So I want to make sure that you explain our audience what's total worker health.
Yeah. So total worker health is a holistic approach to occupational health and safety that goes beyond the traditional workplace safety measures. So it recognizes that the well-being of workers is influenced by a combination of factors, both that are within and outside of the workplace. So job-related factors such as wages, work hours, workload, interactions with co-workers and supervisors, and even access to paid leave impact the well-being of workers, their families, and their communities. So it aims to integrate work-related safety and prevention of health hazards with the promotion of overall well-being, including physical health, mental health, and social well-being. So one example of a total worker health intervention would encourage managers to openly speak about mental health and the resources available to staff like EAPs or taking a mental health day.
That's amazing. And let me clarify something before we proceed with the questions. The Latino Chamber and the Colorado School of Public Health had become partners in a very intentional way. We want to make sure that the well-being of our community, specifically the BIPOC and the working community in Colorado, has access to resources and topics like mental health, physical health, which is as important as mental health. But we want to make sure that it gets to all of you in the language of your heart. So this interview, we're going to repeat it again in Spanish. So if you feel more comfortable hearing this in Spanish, look for it. We're going to have it on our YouTube channel and Facebook platform, so you can watch it there. And continuing on the same topic, I want to ask you, can you talk to us a little bit about Health Links and what supports Health Links can provide to businesses?
Sure, thanks. So Karely's talking about sort of an overarching way to approach worker health and safety, and HealthLinks is our program that specifically supports businesses to achieve total worker health at their workplace. So we have established steps and that so like for example, a business will start with an organizational assessment, and that will assess a wide range of safety and health topics, and based on a business's results from that assessment and any unique interests that they may have, we then offer evidence-based advising that then leads to a curated action plan for that business. So let's give an example. Maybe a business is concerned about how their staff may respond in an emergency situation. And so maybe one goal from that action plan would be to develop a plan for disaster and emergency preparedness. And our recommendation for a first step would be forming a planning committee and really making sure that there's somebody from each level or workers from each level of the organization on that planning committee to provide context. So depending on a company's needs, we can also provide additional advising sessions through HealthLinks to address any challenges or concerns that arise when implementing total worker health as an employer.
That is amazing. And I really like that you guide those businesses throughout all the steps that they need to follow to have policies and basically a plan in place. That's amazing. Something that I also want to mention is that two of the key elements of the chamber obviously are businesses, but also workforce development. And this is part of our workforce development efforts, this partnership, because we want to make sure that not only people see the chamber as support for business owners, but also those employers that are seeking help and support that don't know where to start. And sometimes business owners are too busy trying to run their business. So if you are an employee and you think this would be of interest of your manager or the business owner where you work at, please feel free to pass this information and the link to this video. Obviously, Madison's and Karely's information are going to be in the description of this video, so you can contact them later. But just make sure that if you need any support, you can contact the Latino Chamber and we'll refer you to the appropriate people, including Madison and Karely, or reach out to them directly. That they're totally fine with that. So one last question that I have for you. Where should members go first if they want to learn more about this?
Yeah, so we recommend you to go to our website to learn more about what we can offer to employers and employees. If you're an employer, you can find more information about HealthLinks. If you're an employer or employee, we have resources and training at no cost to you. So for any questions, trainings, or specific resources, feel free to reach out to either of us. We'll include our emails in the description, and we'll also include our phone number in this description. Our website will also be included in the description since it's a little long URL. But yes, we'll also love to meet you in person on April 11th at the LCC Cafecito event, where we'll be presenting an OSHA recommendations for a healthy and safe workplace.
That is pretty cool. Thank you so much for sharing that. And yeah, definitely you're going to keep seeing Karely and Madison throughout the year with all of the events and online platforms that we share in the Latino Chamber. But also, don't wait until April. Like Karely said, we're going to put in the description of this video, we're going to put their information and the link to their website. So feel free to take a look at it, or take a look at it, write your questions and concerns, and come to them in April to ask in person. So they're both bilingual, so they'll be more than happy to answer questions in the language that you prefer. Anything else that you guys want to add?
I think just that we are here to support, like you said, workers and workplaces to create as healthy of a work environment as possible. I think the end goal of total worker health is for someone to leave work healthier than when they arrived. And we believe that's possible. And hopefully we can provide some tools to help somebody get to that point too. Mm-hmm. It's a long journey, but it's possible.
It is possible. And with these partnerships and collaborations, we'll make sure that happens. Thank you so much, both of you. And let us know if you need any support from the chamber, and I'm sure chamber members will reach out to you soon.
Great.
Thank you.
Thank you so much.